Good afternoon, everybody. Today we are going to talk about the IVC, the aorta, abdominal IVC, abdominal aorta, and the portal venous system. I have the anatomy on the left side of my screen. I have the ultrasound image on the right side of the screen. We're going to start by turning sagittal and looking at the length of that IVC. So here we go. We're going to fan to center. There we go. And we're going to see that IVC entering the right atrium of the heart. You can see it on both the sagittal image on the anatomy and again on the ultrasound image over here. I have removed all of the shadowing from bone and all of the shadowing from bowel just to give you a better look at things, okay? So what you are seeing here is we have the IVC, we have this hepatic veins dropping into the IVC. They're the last major set of abdominal veins to dump into the IVC before it pierces the diaphragm and enters the right atrium. If we move down on the IVC a little bit, there we go, you're going to see some more branches. I'm going to go ahead and turn transverse. We're going to look first at those hepatic branches. So here we have those hepatic branches dumping into the IVC. We can see the left hepatic vein right here on ultrasound. We have the middle hepatic vein right here. Okay, it's this one right here. Go, and then we have the right hepatic vein over here. We see that one on ultrasound as well, right here. Right here. It'll come back in as the patient breathes. Okay, alright, so that's that one. So we have the three hepatic veins dumping into the IVC. As we move down that IVC, the next set I want you to be aware of are those renal veins. Okay? So here we have IVC again with the left renal vein on the right side of your screen and the right renal vein on the left side of your screen. On ultrasound, you'll see the kidneys on either side. You'll see that IVC right there. Left renal vein, right renal vein is that bright line. Okay? Now as we come down a little further, we can watch for where the two iliac veins converge to create the IVC. Okay, from inferior it's going to look like it's split. Okay, so here is that IVC. You'll see it elongates, gets wide, and then it becomes two vessels. Each of those is an iliac vein. We have the left and right iliac vein. If I turn, you can see the left one heading down to the left leg right there. And then if we turn on this right one, there we go, you'll see that right one heading into the right leg. Okay, that pretty much covers the IVC. Those are the main branches you want to know about. You want those iliac vessels. You'll want to see the renal veins. There we go. And then you'll want to see those hepatic veins. Now, a couple other things to keep in mind. The gonadal veins do also run back to the IVC. The right gonadal vein is going to run directly into the IVC. Let's see if it's even visible here. I do not see it, okay? But the right gonadal vein is going to run right into the IVC. On males, this will be the right testicular vein. On females, it'll be the right ovarian vein. On the left side, the left testicular vein, the left ovarian vein, they're going to enter the left renal vein. They will branch into and dump into this left renal vein. And then the left renal vein will join the IVC. And that's how the left gonadal blood supply gets back to the IVC. Okay, that takes care of the IVC. Let's take a quick look at the aorta. We're going to slide back up. There we go. Okay. Here we go, there's the heart. I'm angling up from the xiphoid process. Now as I come down, we'll see that aorta come into view right there. Okay, I'm going to turn sagittal on it. There's IVC. If I have IVC, I need to fan to the left because my aorta is going to be to the left of the IVC. So there we go, aorta right there. Okay, we can see the first anterior branch of the aorta right here. That's the celiac trunk. We're going to come back and talk about that in a moment. The second anterior branch is going to be the SMA, superior mesenteric artery. Okay, if we move down the aorta, we will see yet another anterior branch right here, and that is going to be the inferior mesenteric artery. Those are your anterior branches. Okay, let's look at them in transverse. Up high again, there's the heart. We're watching that aorta. Here's the aorta right here. Okay, we're going to see the celiac trunk branch off right there. Okay, so there's celiac trunk on the ultrasound image. You see it right there. That's celiac trunk right there. Okay, now we'll have the splenic vein. Splenic artery. There we go. We got splenic artery coming off to the left towards the spleen. Right there. Okay, and then on the right, we have that common hepatic artery. You can see it right there. See if I can attach it for you. There we go. Celiac trunk. There is the common hepatic artery heading into the liver, the splenic artery heading into the spleen, and the left gastric artery coming off anteriorly. Okay? We can see that on ultrasound right here. There's the celiac trunk. There's the split. The hepatic artery is going off to the right towards the liver. The splenic artery is heading back posterior and to the left to the spleen. Okay? Now we're going to move down that. We said we'd see the SMA. Here's the SMA coming off right here. On this one, you're seeing the SMA right here. Okay? Next is going to be those lateral branches, the right and left renal arteries. You should see them right here. So here's the right renal artery squeezing behind the IVC. Here's the left renal artery right here. Now, I didn't mention this earlier, but you'll notice here with the IVC, the right renal vein coming from the kidney to the IVC is pretty direct. The left renal vein has to squeeze between the aorta and the SMA. So it's this dark line here that's running in front of the aorta. Okay? So there's our renal arteries coming off the aorta. Over here, red and blue. Red is for the arteries and the blue is for the veins on the anatomical model, not necessarily on our color Doppler, so don't get that confused. Okay, so those are the renal arteries. If we move down a little further, we have a gonadal artery coming off right. See, that's the SMA right there. Let's see if they have gonadals. No gonadals. That's okay. The gonadal arteries are going to come off anterolateral below the inferior mesenteric artery. Remember we talked about that. The inferior mesenteric artery is right there. Okay? And then the last thing we're going to have are the two iliac arteries. The aorta is going to bifurcate into a right and left iliac artery. You can see the split here on an anatomic one. Let's look over here. You'll see it gets wide, and then we split into two. Okay? Right and left common iliac arteries, they're going to split again into an internal and external iliac artery. Let's see if we can, there we go. There's the left one. Left common iliac splitting into the internal iliac and the external iliac. External iliac is going to head for the left leg. Internal iliac is going to feed the pelvic organs. Okay, let's see here. The right one, there goes the right one, coming down like this. It's right there. Okay, let's move over a little bit more, see if we can watch the split on it. And there it goes, heading for the leg right there. Let's see. There's the right one. common iliac, right internal iliac, right external iliac. Okay? That's the aortic anatomy. Let's go back and take a look at the portal venous system. Okay? So our portal venous system runs into our liver. It's going to be this gray system right here. Okay? The portal venous system is formed by the superior mesenteric vein. We see it right here, running next to the superior mesenteric artery, and the splenic vein. I'm turning transverse now. Here it is coming from the spleen, running behind the pancreas, meeting up with that superior mesenteric vein, and then the two of them are going to run into the liver at a vertical orientation. Once they enter the liver, they're going to split, okay, into right and left portal vein. The right one's going to have a right posterior portal vein, a right anterior branch to the portal vein. The left side is going to do something similar. You can see we got this one here, and we got one right here. Portal venous system is going to run all the way through that liver, and it's going to form the portal triad with the hepatic artery and the common bile duct. Okay? Now, if we look at that portal venous system on ultrasound, okay, there's stomach, here's our spleen over here. Okay, we want to see that splenic vein. That's this dark area running posterior to the pancreas. Okay, it's going to run over to the pancreatic head. Let's get that pancreas very nice in the image. There we go. Okay, pancreas is right here. Portal venous system is below it, right here. Okay, and then we'll see it enter the liver right there. Portal vein entering the liver there. Okay, that concludes this video for the CAE assignment. Your job when you come in will be to capture a certain number of images, and I will be posting that worksheet for you in Canvas.